Premier, good afternoon to you. One can understand what the Premier wants to do. He says that people who test positive for the coronavirus are supposed to self-isolate at home if they don't need medical care, and they aren't following the regulations. In other words, they aren't making sure they don't pass the virus on. Is he on the right track?
Well, according to HIV and TB experts, he definitely is not. And they're quite upset because they feel that there are many lessons that we can learn from TB and HIV. And as you've just pointed out, that if you make someone feel punished for having a disease and in the process take their agency away in how to implement a preventative measure such as self-isolation, it results in a faster spread of that disease. And that's essentially because you stigmatize the disease and you scare people away from being tested. So we have an example in the case of COVID-19. We have those two Limpopo doctors who were forced to quarantine in a Limpopo State Hospital. And they had pictures on social media. They were essentially locked up in two small hospital rooms. They mentioned they didn't have toilet paper in rooms. Now, if you're a frontline health worker, and you know your chances of getting infected are high because of your job, and you also know that you'd essentially have to be locked up if you get tested positive, you are very likely to find reasons not to be at work, and that will obviously have a very bad effect on our ability to fight COVID-19 because we need all the health workers that we can find. I spoke to an infectious diseases specialist, Francois Venter, from the Wits Reproductive Health Institute this afternoon, and he is very upset because he says KwaZulu-Natal was the first province to actually implement lessons that they learned from TB. And what they learned was that if you force these people with TB to isolate in a state facility, you get very bad results. What you get better results with is if you have community buy-in and allow patients to have input in how they want to self-isolate. A government facility should really be the last option. So you should first look at options to get community health workers to support people at home to self-isolate. And you should also look at giving them incentives to do it correctly, to, for instance, use food parcels each day if they did stay indoors. And if they live in a place where it's impossible to self-isolate, experts say you should ideally also provide them with an incentive to go. So it should ideally be accommodation that is better than where they currently live. And you should also look at social support. So if you're going to force someone to go or have someone go to a government facility and they have no childcare and their children are going to be left at home, if you don't help them with childcare, you're likely to have someone who doesn't want to go. And then lastly, the availability for beds for self-isolation at state facilities is likely to run out if you force everyone to go. We are talking about hundreds of thousands of people who will be self-isolating in the coming months. And if you then force middle-class people who have homes where they can self-isolate to go, it's essentially a waste of resources because you will take up the beds of people who don't have homes where they can do that.